Hey, everybody. How's it going? Dan here with Janice, our amazing, wonderful physical therapist who works specifically and exclusively in the music industry. She's seen a lot of people get poked in the ear with a violin bow, the other viola player was too close to them, and all kinds of things, right, Janice?
That's right. Eyeballs falling out, the whole 9 yards. No, not really. That's a lie. That's a lie.
So, folks, if you've never seen this show, check out the description. We'd love for you to chime in with not only where you're watching from, whether you're watching live on YouTube and Facebook, or YouTube or Facebook, or watching the archive on any of our other channels or those. Chime in with where you're watching from. And even if you're not a musician, do you have any like physical ailments that are from repetitive motion injuries or lifting or just maybe using the same tools over and over? But if you're a musician, we definitely want to know what you're experiencing. So anything in the realm of like bursitis, tendonitis, lower back pain, sciatica, the list goes on, right, Janice? I mean, like Rick Wakeman
Yeah.
said, the end is listless.
Yeah, I mean, my job is never the same. It's never a dull moment in my world because I see pretty much everything.
Is that part
Um,
of what you enjoy about it?
I do. It's not like I go and do the same task over and over again.
Yeah.
I have people who play all sorts of instruments and do all sorts of different jobs within the music industries, producers, stagehands, you name it. So it's always I never know what's going to come through my door, and which is kind of the fun of it too.
Absolutely. That's cool. So folks, if you have any of that, let us know. In the meantime, what we're going to start off with is I barely made it in the nick of time to do the show because I was getting a massage. Want to give a shout out to Mary O'Donnell of Sky Blue Massage Spa. Just amazing here in Globe, Arizona. And I do it for, I don't have to be hurt or injured to go do that. I will go do that, believe me, if I'm hurt or injured, but I do it somewhat routinely because it's part of my disconnect. It's part of just letting my brain go. But also, as a drummer, and you ladies and gentlemen, think about this. You go out, you do gigs, you lug your stuff, you set up. I remember a gig I did last month, and I told the guy that I was the main guy I was gigging with, I said, I need a nap. And all I did was set up, and I took a small kit too. Maybe that's a sign of my age, but I think I'm in pretty good condition. It was pretty funny when it happened, and he laughed. He's only like 3 years younger than but seriously, you work your bodies as a drummer, whether you play metal, whether you play soft jazz. It's the most physical instrument. Running around the stage with a guitar or banjo doesn't count. Just in playing the instrument, it's the most physical. And I think it's worth getting your fascia worked, your muscles worked, getting stretched, pulled. She worked on all these different nerve points. I could feel her. I have big calves. I could feel her dig into my calf, and then three of my toes went numb for a moment. And
Oh no.
it's amazing. It's like a good pain. And she has one of those tables that also bends. So
Oh,
she
sure.
stretched me out on my back and then stretched me out on my. It was just an amazing experience. I would go every week if I could. But have you seen a correlation, Janice, between people who do pay attention to that sort of physical self-care and less injuries, or minimizing certain types of injuries, or injuries that they do get aren't as bad, or they heal easier? Like, is there a correlation?
Oh, sure. Yeah, I would say so. I mean, you think about like not just music, like percussionists and like people who are drummers, especially like don't tell the other instrumentalists this, but they have probably the most physical job of all the instruments that I can think of. Um, you know, Short of like marching band, like that's a whole different
Right.
situation. But like from a gigging musician's perspective, most of the time it's the drummers that are the most physical. And just if you think about like what pro athletes go through, they're not just like gonna roll out on the field and just like go and
Good
play.
point. Good.
They've got a whole team. They do warm-ups, they do conditioning, they do
And the after game
so many
treatments.
yeah, they do so many things before and after the actual game itself
Yeah.
to kind of maintain their bodies during the season, and then even on the off season, they're also doing things too to stay limber, stay mobile, all that stuff, stay strong. And a lot of it, the way I think about it is, um, let's say that you never get any body work, you never stretch, you never strengthen or anything like that. You're just playing. And maybe you're an amazing player, and there's a ton of people who are amazing players who don't do things actively to take care of their bodies, right? And they're still okay. We've had conversations about that before in the past.
Yeah.
But let's just say that one day something comes up where they start to feel, tendonitis in their forearm, or they get some wrist pain. Then it's like you have to, in order to like treat that, you have to kind of peel away layers and layers and layers and layers of stuff that has built up over time
From
in
not
order to kind of,
conditioning and
from
not
not
doing these things.
conditioning and not doing anything.
Wow.
So it's like you have to kind of think about it in the framework of like, so getting a massage is not necessarily like essential for someone's well-being, although it is very helpful.
Right.
Some people just don't like to be touched, right? Like some people
Right.
just do not enjoy that massage experience. Some people love it, right? And so, but if you're not doing things to maintain it, like stretching or some kind of mobility work, some kind of strengthening, you're you're gonna have to kind of you're kind of building your strength, your flexibility on whatever that foundation is. And so that foundation might be a little shaky to begin with because you might have some tension, you might, not be as flexible as you could, etc. And so you're just kind of like adding and adding and adding and adding.
Yeah.
If that makes sense.
Absolutely. Where I fall short the most in everything that you said, or at all, honestly, is I am not flexible. And I told Mary that when she gave me the tour of her studio first, she had this whole yoga area, and I explained. I said, I cannot even get into a cross-legged position comfortably, sit cross-legged comfortably, or get out of a cross-legged position easily. I said, I've always admired people who are super limber, and I need to. So I'm going to start going to her yoga studio now. I've always wanted to take yoga
Nice.
for whatever
Yeah.
dumb
There you go.
reason. I've always just put it off, but now 62 and a half, I think it's time to take up yoga and get a little flexible. The good news is I think I have, and I know this isn't a determiner, anyone that's really overweight can still benefit from it and get limber to a point, but I'm
Oh
pretty
yeah.
lean. My body fat percentage is probably about 12, 13%, maybe something like that. I'm small.
Yeah.
I'm maybe 5'7.5" if I'm lucky these days. Used to be 5'9", then I had a bunch of kids. But I've got I think a nice body type where yoga would really do me well. I
Yeah.
think I'd adapt to being flexible really easily, whereas not all body types can, you know. So why
Yeah. I
I put it
mean,
off, I don't know.
yeah. No, I mean, like a lot of times though, like people who are overweight, that actually, from what I know or what like knowledge that I have, it shouldn't necessarily have any direct correlation on someone's ability to be flexible or not. A lot of
Mhm.
that can be just like your body type in general. Some people are born to be very hypermobile, like you think about like the Cirque du Soleil contortionists, like
Yeah,
their ligaments are just like super loosey goosey. And
yeah.
then you have other people who are just more on the stiff side, and that's just naturally how their bodies are. Now,
But can they get past it?
I'm sorry?
I'm sorry, can they get past that if that's naturally how they are?
To a certain extent, they
Okay.
can, but a lot of it, like someone's baseline kind of foundational, you take away all the muscles and stuff like that, like the muscle flexibility. Someone's flexibility from the very, very baseline foundational level is dependent on how tight the ligaments are throughout the body or the connective tissue
Oh,
is throughout the body. So connective tissue is like the ligaments, the fascia, all that stuff combined. And then what happens is like we go and mess with their bodies, right? A lot of times people sit in front of a computer, or they sit at their desks, or they sit and practice all day. And our bodies, the way I like to like explain it is like our bodies learn how to be efficient in the positions that they're in the most. And so if
Okay.
you're sitting all the time, that means that you're not really needing to go into kind of those other positions, right?
Right.
And so your body's just like, I don't need to have the flexibility to go out. I'm just going to learn how to be really strong and flexible with what my brain and what my person is telling me that I need, how I need to use my body.
So now
And so
I have to interject and say now I'm completely freaked out that maybe between that, because I said a lot, between that and maybe stiff ligaments, I'll never be flexible.
no, there's always room for improvement. I think that's kind of like amazing thing about our bodies. Now, will you be a Cirque du Soleil contortionist? No, you will not. Like I but I think, most of the time, most people can make improvements in flexibility if that's what they want or if that's
Right.
what they need.
That's cool. We do have some people chiming in. We've got Robert Fernandez in Altadena, California, not far from
Oh,
where I grew up.
cool.
Yeah, very
That's
cool.
pretty close to where I am right now.
Yeah, and I grew up in the San Fernando Valley, so nice. And then Christopher John Thiel in San Diego, beautiful San Diego. Got a son and his wife there. I love San Diego.
Yeah, I was just down there a
Christopher,
couple weeks ago.
oh really? Oh, I saw
Yeah.
that actually. Yeah. And Christopher says, I found heated yoga to be the best, but you got to be consistent.
Yeah, that's true. That's true.
What is
So
heated yoga? I'm not familiar with that
it's
term.
hot yoga, so I forget what temperature that they, like, set the studio at, but,
Oh,
it's you're just doing yoga basically in a sauna. Is
wow.
which
That
is
sounds
which is
neat.
great. So, like, I think the thought behind that, there's a lot of, a lot of things that they talk about, but it helps increase circulation. The heat warms the body, so potentially, if you wanna stretch your muscles, it makes the muscles more pliable to allow you to do the stretching. So,
Right.
hot yoga, there's several studios. It's not a, kind of fringe uh, kind of thing, but yeah. So hot
That's
yoga is,
neat.
at least here in California, like there's a lot of hot yoga studios.
Sounds like a great name for a band, Hot Yoga. And the first album could be called Doing It on the Mat. There you go. And
Very
Christopher
good.
Christopher also chimes in and says repetition, repetition, repetition. Yeah, it's like so important, like playing like a language,
Yeah.
if you know a second or third language, don't use it for a long time, you gotta like tune back in. Your body, I'm
Yeah.
sure, is the same way, you know?
Exactly. It's kind of like what I was alluding to just a couple minutes ago. It's like it's almost like you need to like teach your body where you want it to go. So if
Mm,
you want it to be more limber, you expose it to those positions where you want it to be limber into. If you never get out of that position, then your body's just going to be like, I don't need that. I'm just going to stay here.
right.
Right?
That
So,
makes
yeah,
sense.
repetition is really key. It's the main thing that I always tell people to do is so one common thing that, people usually do is like, okay, I'm going to do one giant stretch session, one giant strengthening session a day. And that's going to be my mobility for the day, which is great. It's very helpful and at least you're getting something. But how often do we get to the end of the day and maybe our mobility session is like a 30-minute mobility session, right? You get to the end of the day, like, oh man, I'm so tired. I've had the longest day. I've been so busy. I just want to go to sleep. And then you don't do it, right? And so
Right.
you kind of miss out on that time. So,
Or, well, I'm sorry, but Janice, what if someone does it in the morning and then they have quite a physical day or they sit all
mhm,
day and then don't do anything else? Did it kind of waste
right.
that session?
I wouldn't say waste, no,
Okay.
because again, it's about teaching. Part of it is teaching your body to be in those positions. So I
Oh,
would not say that it's a wash.
okay.
However, in the last few years, I've what I really try to encourage people to do instead, they can also do like that. They can still do that long, big stretch session. But what I've been encouraging people to do is to scatter in little stretches throughout the day. So you do 30 seconds here, 30 seconds here, 30 seconds here, 30 seconds here, maybe like every 30, 45 minutes kind of thing. And it could just be like you're doing your work and you're just doing like a quick stretch here, kind of letting the muscles, relax. All together throughout the course of the day, that could end up to be 30 minutes worth of stretching, right?
Okay.
And also, you're not allowing your body to be in one position for hours on end. You're kind of breaking it up a little bit and introducing your body to different positions, even though you might be, still sitting at your desk or doing something like that.
Yeah.
And it's a lot more like feasible for someone to do a 30-second stretch or a 1-minute stretch than it is to kind of like drop everything,
Right.
get on the floor and do something while with like lots of other people standing around and like, what are you doing over there? Like, so I find that it can be a lot more effective. It's a lot less overwhelming, and especially if someone's never stretched before in their life or for a long time and they don't quite know how to carve out that amount of time, like a 30-minute session in their day. Doing it in small bits actually can be really, really effective.
I'm going to start with that.
Yeah. And I kind of got that idea. There's a lot of research that's been done now. So not exactly my idea, but there's a phrase, and I can't remember if we've talked about this before or not, but the concept of like exercise snacks. And so what that is so, normally people recommend, like the American College of Sports Medicine recommends like 30 to 45 minutes of cardio, like 5 times a week kind of thing, right?
Okay.
So again, in this day and age, unless you already have it built into your routine and your regimen,
Right.
not that many people have that routine, or not as many people as they should have that built into their routine where they have 30 to 45 minutes to do some kind of cardio exercise where their heart rate is up and everything like that. And so what they're proposing, or what they're suggesting, and there's research that backs this up, is that you can do 3 to 5 minutes of like high intensity exercise, like jumping jacks, for example, or you're just running in place really like for that amount of time, and like just 3 to 5 minutes, and you do it like 3 or 4 times a day. That could be almost as effective as you doing that 30-minute or 45-minute session in a day.
Oh, that's great to know. And I'm
So
sure
it's yeah.
it doesn't hurt to do that, even if you are going to go to rehearsal for an hour and a half that night and play.
Yeah, or if you've been practicing, you've been like, working on stuff, usually people will take a break every 45 minutes. And then like, why not just insert, like when you take that break, insert like a burst of exercise, get some blood flow going. That's actually going to be helpful for your learning too, because you're doing something different with your body.
Right.
So yeah, I really, really love that concept of it, because
Yeah, that sounds great.
it kind of takes away that, like, especially someone who hasn't exercised a lot, it kind of takes away a little bit of that fear. It's like, how am I going to do this? How am I going to build
Yeah.
this into my day kind of
And the
thing?
the
So
rationalization of, yeah, I just don't have time.
yeah, exactly. Like everyone probably has 2 minutes of time to just do something.
Yeah. Yeah, great. Anybody watching have any physical ailments that they want to ask Janice about, or you want to point out, or that you've gotten past and know how you got past, whether it was from drumming or how your setup is, or just getting older and noticing that things are a little bit different after you play or during when you play. And often, if you're noticing a certain injury or pain while you're playing, there's probably a correlation between, depending on what the pain is, of course, either how your setup is, how your posture is, how hard you're hitting. Oh, my forearm hurts all the time after I drum. I don't know why. Maybe because you're hitting too hard. There is such a thing in drumming, boys and girls. But there's a lot of things that your body, Janice, right, will tell you when there's an issue. And if
Oh,
it's
sure.
routine, you might just accept that, oh, well, this is what happens when I play drums.
Oh, sure. Yeah, I mean, your body communicates with you all the time, and it's our job to kind of figure out, like, kind of interpret what that all means, right? And
Yeah.
it can't use words to tell us. That would be weird because then we'd just be talking to ourselves all the time. I mean, I do that anyways, but yeah, I mean, there's there's things that are out there where people try to kind of decipher what our bodies are telling us. There's a thing like if in the exercise world, there's a thing called the soreness rules that I tend to point people towards often.
Mm,
It's basically a way. So pretty much everyone's like felt muscle soreness before. Like if they lifted
sure.
something too heavy or they like go and do a workout, they usually will experience like soreness for a day or two, like afterwards.
Right.
So using that soreness and like how much soreness it is, how quickly does it go away as a way to determine was that workout that you did or was that activity that you did too much, too little, or just right. So I can send you the image of it, but basically it's like if the pain doesn't go away with warm up, then you need to drop the weight or drop the intensity of like what it was that you did. Um,
Interesting. Is there a magnitude of pain that's like a baseline? Like this magnitude is normal, but anything
no,
above that is okay.
no, and the reason why that is, or what I'm I'm assuming, I'm pretty sure this is why that is because everyone's pain is subjective.
Oh, that makes sense.
So someone's 3 could be another person's 7,
Right.
right? And so whenever I'm asking, like you go to the doctor and they're like, "Oh, how bad is your pain? Scale 0 to 10." At least for me, and I would hope that any other medical professional is looking at it the same way, that I'm never going to sit here and compare someone else's number to another person. But where it's really valuable is if, like, I have people coming in every week or every other week kind of situation. So I can trust that that person's 3, if they come in the next day and it's like, yeah, my pain's worse, it's a 5, that is something to kind of take note of because
Yeah.
they're comparing with themselves. Or yeah, things are really much better. It's a 2 today, or the pain like was a 1. Like that is
Right.
valuable with when you're comparing it within one person. But
Yeah.
yeah, it's really challenging to just throw a number out there because that could mean so many different things.
Yeah, I never thought of that when people ask when, if I go to the doctor for something, it's been a while where
Yeah.
I've had pain, but when they ask that
Knock
question,
on wood, yeah.
yeah, and I have a pretty high pain threshold actually. Um, I almost cut this finger off once, and with
Ugh.
like a packing blade came up through.
Oh, yeah.
Yeah, they had to put
Ugh.
like 7 local shots before they could stitch it. 'Cause
Oh
it
my
just
god.
wouldn't go numb, and I said, "You should have just stitched it." Like, I
Yeah.
only got, like
With the amount of time that it took you to
yeah, and the
numb it
amount
up.
of pokes, it's like, it's the same thing. It was sorta dumb, but I thought that
That's
was
funny.
kinda crazy. And I had a procedure, I won't get graphic, years ago, after our producer Steven was born, there's a little hint. I had a procedure, and they said that this stuff you got to be awake, but this is going to really make you feel like you're floating off the table and you won't feel anything, but you'll be aware. And it got to a point where doctor would come in and say, "So do you feel it?" "Yeah." I'm like, "No, not yet." He says, "Okay, I'll come back." And the nurse is with me. And she asked me about 15 minutes later, "You feeling anything yet?" I'm like, "Not really. I mean, I'm relaxed, but no."
Yeah.
And he comes in one more time. And then, like, literally another 20 minutes, almost 50 minutes have gone by. I see him look through the window of the door and go like this to her. And she says, so he walked in, he said, "Yeah, I'm sorry, but we're just going to have to go do this." Halfway through the procedure, it hit me
Oh,
halfway
geez.
through. Yeah, it was the weirdest thing.
Wow.
I have a high pain tolerance, but also a high tolerance to, I guess, pain medication
Medications.
and stuff.
Yeah.
Yeah,
Huh.
it's weird. So we're all different, and it's such a great example that you use of measuring pain because what might be a 3 for me could be a 10 for someone else because I have
Yeah.
that high pain
Yeah.
threshold.
Yeah, absolutely. And pain is such a interesting thing too, right? Because like all animals, all humans experience pain. And like the role of pain itself is to serve as like a warning signal to our brains that something is potentially harmful to us, right?
Right.
And so we touch a hot stove, our pain nerves, we have pain nerves, we have sensory nerves, there are different kinds of nerves in our bodies. Um, and then we're like, oh, ouch, ouch, ouch. But like you can have those same nerves, you know, you go to a microwave, you grab something and you know it's going to be hot, right? And you're like, oh, I just got to get this to the counter.
Yeah,
And you're like,
mind
ouch,
over
ouch,
matter,
ouch,
mind
ouch,
over
ouch,
matter.
ouch, 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 ouch,
Right,
right?
exactly,
But if
yeah.
you go and touch something that's hot, your brain automatically, if it doesn't know what it is going to be like danger, danger, danger. Oh,
Right.
that really, really hurt,
You forgot your
right?
mind's somewhere else. You touched the
Yeah. And
plate.
so pain, there's like absolute pain, right? Like if you almost cut your finger off, that your body's like danger, 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 harm, harm, harm.
Yeah.
But then there's also perceived pain that's based on our experiences, based on our culture. There's a lot of research done on like culture and pain. And so a lot of our just individual experiences can dictate how our brains respond to a painful
Right.
stimulus,
It's a
which
perception.
is like, yeah, so it's really, it's so cool. I mean, pain is horrible. I don't want anyone to be in pain, but it, like, the concept of it is just really fascinating to me.
Yeah.
It's a really interesting area to kind of explore.
So if you folks hurt from playing beyond what feels like just a real extensive workout because the set was just long and it was,
Yeah,
very vibrant and all of that, there could be something else that your body's telling you. And again, it could
right.
be posture, could be your setup, could be you're hitting too hard and those vibrations are just going through your arm. And there's all kinds of things. So you got,
The-
pun intended, listen to your body.
I think the main thing that you can use to, help you listen to your body is like if you normally play and you don't have any pain or, sensation, like kind of things that are like, ooh, that didn't feel like quite as good, but then you do, that's the time that you should pay attention.
Right.
Because you know what your baseline is. You know what you normally feel like when you're playing. And so when something doesn't feel quite right, or you're starting to get, oh, like this doesn't feel as great, I'm feel pain when I'm gripping or like every time I do this kind of hit, that could give you some clues, and you can do some detective work or troubleshooting yourself to see, okay, well, what got me here in the first place,
Yeah.
before you go and like run for the hills and seek care, like come and find me or anything like that.
Right. Right. And speaking of which, Janice does do some teletherapy. What would you call that?
Telehealth or
Telehealth.
virtual consultations,
There you
there's
go. Yeah.
whatever you want to call it.
Yeah. She's in the Los Angeles, California area, but all her information is in this post. So feel free to reach out. And
Yeah.
it's always been an interesting topic to me. Because I've gotten hurt playing. Gosh, I thought I broke my nose once, just whacking, my big nose sticking out in the airspace of a stick,
That's
but
funny.
finger and hand drums, just
Yeah.
hitting so hard and the swelling or playing for so long,
Yeah. Well, I
and
mean, I became a PT because I got injured playing the violin.
oh, that's
So, yeah, so that's what led me to do what I do now.
how old were you when
Um,
that happened?
oh man, I was in college, so I was 20 or 21, like when I had my surgery on my shoulder for it.
And what were you
But it
studying
had
for before that happened and before, like, did you totally change paths because of that?
Yeah, so I was a piano performance major, but I was also on scholarship for violin. But the violin was the one that kind of ended up causing the injury.
Yeah.
I finished my degree. I had surgery between my sophomore and junior year. And then I was able to go back to playing. I finished my degree. And then after I finished, I decided to change course and go the science route. So
Wow, interesting.
that, yeah, that took, because I was a music major, I didn't have any courses that I needed, of course, to apply for a medical degree.
Right.
So, yeah, so it was definitely a process, but I'm glad I'm here and I'm glad I'm doing what I'm doing. So,
That's awesome.
Yeah.
Awesome. So, folks, you can find us. I think we're doing a show in December. Janice and I will talk about
I think
that.
so. Yeah, we'll talk about it.
Let me see if we have a date yet. And if not,
I think we do. I was just looking.
I think we do too. We are doing the
December
12th.
12th.
Yeah.
Mhm.
Friday, December 12th, same time, noon Pacific, 3 p.m. Eastern, 8 p.m. UK time. Tune in. And if you have questions about any type of injuries or anything, let us know. Well, let Janice know. I'll ask the question for you and she'll answer.
You can
Thanks
answer too if you want.
in. Yeah, I'll make up some fun stuff and you can correct me.
There we go.
Thanks everybody for tuning in. And Janice, thanks as always.
All right, my pleasure.
All right, thanks.